information about myself and about the company in general. I'm 10 years already in software development, and I've been starting as a mobile engineer and grew quickly to software architect and mobile tech lead. Then in 2014, me and another guy on the picture on the right, Andrew, we both founded Softermii as a software development company, and we grew already to a little bit more than 100 team members. We've got one unicorn on our portfolio, and completed more than like 82 projects. We provide like full cycle services to our clients in mainly 3 industries, like e-commerce, healthcare, real estate, and like different kind of services. We can start with just an idea and proceed with like design documentation stages, and then with development for like different platforms like backend, frontend, mobile applications, integrations, data migration, and so on, and then continuous support. Of course, one of the main of our services at this moment is video conferencing, and we started to see a lot of like huge demand, obviously a little bit after quarantine was established by the government, and basically because of we had this expertise already, and we've been developing and completing projects in healthcare for it's one of the case studies I will tell at the end. Basically, we already had this expertise, and we didn't need to go like mistake by mistake when it was so much needed and in demand from our clients. So I wanted to talk a little bit about like how it was before COVID. So teleconferencing was a service many companies were hesitant to implement. Let's look at the 3 aspects of our lives. It's work environment, social leisure, and healthcare. So as COVID has affected all of our life, right? So even considering the growing popularity and adoption of remote work before COVID, most businesses were still concerned about it because of worries around employee productivity, development or usage costs, and lack of integration into workflow. Social leisure, people always prefer physical meetings, traveling, visiting live events, theaters, concerts, museums, etc. For the healthcare, telehealth market like constantly growing year by year, but there are a lot of obstacles. Ruben have mentioned a few of them. I will just expand a little bit more. So regulations in most countries were adapting to video conference appointments, but very slowly. Reimbursement was not possible for such type of care. Different solution store data in different places, and that breaks care continuity. And companies were figuring out how they could educate their patients on how to use the technology behind it. And due to those issues, physicians and administrative personnel were concerned about using telehealth solutions. Teleconferencing felt cumbersome, expensive, and not really worth the effort. And after COVID, when we saw all of like COVID basically changed everything. Once governments began to institute lockdowns and social distancing protocols, we began to see an abrupt uptick in the need for video conferencing apps, as I mentioned. So suddenly companies had to scramble to keep their doors open while still navigating lockdowns, social distancing, and maintaining the safety of their employees. Video conferences went from a niche benefit to an essential component of not only businesses but in our social lives too. Remote work became usual. Happy hours and celebrations moved from the bar to the laptop as we began to navigate how to satisfy our needs for socialization and coming together at the time when it could have deadly consequences. Um, so governments made really quick changes to regulations in healthcare, in particular, in order to save lives and allow people to receive care without them getting out. Right. Businesses needed ways to connect with their employees and customers, and many were not ready to meet that challenge. While apps like Zoom and Google Meet became quickly implemented gaps, many companies saw that these were not going to be long-term solutions due to their lack of features and inadequate privacy protections. Um, Telehealth still facing a lot of challenges, but despite the challenges, we've seen healthcare providers fully embrace the need for custom technology like this, as it's given their patients the opportunity to have better access to the doctors and health providers. Using telehealth solutions, they are able to reach more patients who have mobility issues or difficulty acquiring transportation to from the office. They've got an ability to coordinate and collaborate with other professionals in real time to address patient care. Uh, it can reduce healthcare costs by up to 27% to those who pay for medical care due to the removal and facilities charges, emergency room specialist charges, or expensive office visits. Uh, from one of the studies, I've got numbers that like hospital admissions dropped by 30% while using telemedicine. And, doctor visits were reduced by 60%. Healthcare private investments hit like new record in third quarter 2020, and the record is like 8.8 billion of private investments in this quarter. Of course, COVID made all of those changes, and we wonder like what will be next after the COVID. It is expected that by 2022, the internet video traffic will be increased like by 4 times since 2017. Companies will be more like separating office work and remote work, and basically a lot of people figured out during the quarantine that they actually would like to work from home and that they don't want to go to office to like spend their time and money for like traveling somewhere and so on. Next, I will show like 2 case studies I can talk about, as a lot of projects still under development. This one we've been working on and completed before COVID. It's HIPAA Video, which is the company works at the US and Canada market, allowing patients to have virtual visits with doctors, taking notes. Like doctors are able to make electronic prescriptions to their patients and so on and so forth. And another case study. Sorry. This is one of the projects we completed this year already, and client came to us after the COVID. It's one of the like really large company hosting conferences and events, and we've been able to accomplish the platform like from the point where they were, and they already been able to host one huge conference like a few weeks ago on this platform. This platform basically giving you an opportunity to host big conference with auditoriums, like exhibition where like exhibitors can sit and basically show to participants their products and so on. I forgot to mention regarding like obviously after the quarantine, clients were coming to us saying we need it done like yesterday, and we're always saying that this is like not possible. Even like whoever will be doing the project, even like the most genius people, right? It's not possible to deliver a baby like in 1 month if you have 9 project managers, right? So this client basically followed our suggestions, and we went through like development process with like structured, really good process through discovery stage, and then specifying requirements like of features they need really clearly, and then we've been able to complete it like in only 3 months basically. And another case study, it's like more connected to social, but David will talk about it more. So I'll pass the mic to him.